Patient testimonial. This patient had severe obstructive sleep apnea, was given CPAP, could not tolerate CPAP, had an oral appliance and an awake in-office septoplasty at the Modern Nose Clinic. He is very happy. Listen to his story. His mother will also contribute. Let's record it while we're talking. This is actually one of the patients I got to meet in the early going for the Modern Nose Clinic, and it's been a real blessing for me personally because the whole family has been just great. And most importantly, however, the patient, I won't use their name, it's just, it's like he was stuck and the wheels were spinning like you're stuck in the sand and you're going nowhere. And you would normally think, oh, you go up to OHSU. Oh, that should do it. They should be able to figure it out. They're so smart up at OHSU. And if you don't believe me, you could just go there and they'll tell you that. But in this case, was that the case?
No.
No.
We took Matt to HSU for a decade, and we saw every specialist you can see, every specialist, to help us understand his health. And he went through so many tests, and we couldn't figure it out. And it was finally a nurse practitioner that said he needs to have a sleep study, and discovered he had severe sleep apnea. And since he's had his nose surgery and his oral appliance, he's a different kid.
And think about it too. This family is a unique family. They're intelligent. They're motivated. They're going to advocate for their kids. A lot of us would give up because you start to get this idea like people are trying to suggest like, well, there's nothing wrong. Why do you keep coming up here? Did you get that feeling at all?
Yeah. Oh yeah.
So, it's like it's frustrating because you feel like medicine should be advocating for you, and you feel like you need to have someone advocate for you to medicine because it's really, if it's not easy, well then you must be making it up. Why would anyone drive back and forth from Salem over and over again for specialists if it wasn't something that was really bothering them, right?
Right, and it was important because this is the rest of his life.
It got to the point where I didn't want to go to doctor's appointments anymore because I'm like, what's the purpose? I just feel like they don't really, not necessarily they don't believe me, but I just feel like it's pointless and I'd just rather give up. But she kept dragging me along, so.
Yeah, moms make the world go round. I was going to say that right now, that's for sure. I can tell you, I can tell some stories about my mom. She's awesome. She really advocating for your kids, and so that was a good part too. But I just want people to know that, first of all, if you're a young person and you feel like you don't want to go through life with a CPAP, I mean, we're looking at a really thin guy here, super fit, and it's not like he's going to lose 50 pounds and suddenly not have sleep apnea. He was given a life sentence to CPAP, and there is another treatment.
Well, and the sleep doctor said, don't do an oral appliance, don't do surgery, it'll do nothing. And I'm thinking, look what it just did for this young man who now can go to college and have a successful life, I feel like.
In medicine, we'd like to say that it's a team approach, and to the extent that we as physicians and clinicians of different backgrounds collaborate and work together, I think we always get better results. That day and age of the one really brilliant mastermind who, all these TV shows are about and they can answer everything. Oh, that's a bunch of baloney. And I think that sometimes it's a good learning opportunity even for those people that, it's not true. It's not all black and white. It's not like, oh, if you've got severe sleep apnea, you can't do an oral appliance. Well, this patient had severe sleep apnea. And, the AHI was over 55. And now his AHI is down to the normal range. And so anyway, this is a particularly long patient testimonial. We may or may not use it. It's just that we're hoping someone else out there who may also have sleep apnea and may not want to use CPAP would find the oral appliance to be a legitimate alternative. The other thing I'd like to say, though, is about the oral appliance is that there's a lot of people who say they do it, but there's only 6 people in the state who've done the extra training. What was your experience with Dr. Lee?
Amazing.
Yeah.
Amazing. I could tell she knew what she was doing, did it slowly, because she explained that if we do this too fast or do it in the wrong way, you're not going to get the results that you need. And I think I have complete faith in her, in how she did it, and took her time and it was done right.
Well, as of the recording of this testimonial, she's been doing this for 8 years, and that's all she does exclusively. But it's families like yours. You guys are awesome, and thank you for sharing your story. Would you mind if we let anyone else listen to this who might be interested? Is that okay?
I would love to be able to help.
Oh,
like
thank you.
you help somebody that could benefit like Matt has, definitely.
That is awesome. Well, thanks again. Signing off, Modern Nose Clinic.